welcome to Sleep Television on Channel 37 with me here with you this afternoon, Sean M. Abdullahi, on your show, today's show after lunch. You know, the week don't run too fast as of, not only the week, so many things don't move, rapidly when it comes to, the space and the society space. Development, sometimes don't take place, now some start inside, some things don't grow and all. In this particular time, this is not time, where some man they pray to God at least for 11 months go down and get what if it forget. But with all this, one of the things that we don't happen now, or we like cause for concern, what people want to know about, is about some notices we don't come out of, we don't come out from the, from the medical side, from the medical angle, coming away from the National Public Health Agency, through the Ministry of Health and Sanitation. So many things don't happen in all. We don't see two press notices concerning, sickness where they say they, or sickness where they say, they too, happen it too, but this not just to create an awareness. This get for happen. Okay, well this, it don't happen, no. People need for get precaution. People need for take time, awareness for go about, so that go spread na the country, or go spread na the community, or picking self go get them. Or me and you too, or you will watch me, we're not supposed to forget them at all. So, but first, make I take you through the quote and see what we quote say for today before we take the notice. We quote say a strong health system saves lives before an outbreak becomes a crisis. A strong health system saves life before an outbreak becomes a crisis. When you get a strong health system, na salon, what if you say they happen? That's going to save the lives before any outbreak they happen. So the strong health system, it can force na salon. But as of recent, what did happen? There is a notice will come out from the National Public Health Agency, where this one come out from the 10th of May, this particular month, 2026. But first, what it say? It say Freetown, 13th May 2026, National Public Health Agency alert public to measles outbreak. All right, this is the 13th of May. So now we take the way come out for the talk about the antivirus. What's in this why I mean? It's a public notice on antivirus awareness and preparedness. Now, it's the Ministry of Health and the National Public Health Agency wish to inform the general public, authorities, a close monitor recent report of antivirus infections linked to a cruise ship. Outbreak reported immediately. Current information indicates that the risk to the ECOWAS region, includes Sierra Leone, remains low. So this is a sickness, where they say an outbreak, and they call it what's in antivirus. This could be like that kind of way. Beside this name here come out and all. But before this happen, before this term, we don't pass through Ebola, we don't pass through Corona and all. And now this particular notice don't come up as of happen it, but at least this is not just a public notice for bringing that kind of awareness. Let people aware say something they if we not take time, that's also thing for happen. Yeah. So coming to the 13th of May, the other public notice for them poll. It said the National Public Health Agency alerts public to measles outbreak in Sierra Leone. Say the National Public Health Agency, NPHA, in collaboration with the Ministry of Health, hereby alert the general public to a measles outbreak in Sierra Leone between January and April 2026. Now, according to the notice, they say they don't get 41 confirmed measles cases have been recorded across 8 districts with a national test positivity rate of 75%. Western area urban, Freetown. He said is the most severely affected area, accounting for 15 cases with a sharp escalation to 9 cases in April alone. So, what did the notice say? 41 cases from April, between January to April 2026, we get 41 confirmed cases of measles. Why this happen? We don't pass through Ebola, Corona, antivirus, measles. Why? So people, they keep on remain for they ask a question, all time different sickness, you know, today this come, they say this will come, today this happen, they say this will happen, as of why. But let me take you through some other things for the measles. What did they say that they sign? You can please project for me the measles. All right. Okay. So, but I actually expect from the control for project for me. But when you watch it again, the signs for the antivirus, I believe so we'll get them. So they go project them for we and see what they signs them. They say, you know, for come close to rats or waiting or cats. That's not the signs and all. But in the conversation, we go get a medical expert, the communication lead, Winahara Thomas, the risk communication lead for health education programs manager, and we don't forget Fuad Tijan Kamara, final year medical student, commerce, USL, national officer on medical education, and SCORM director. So, Sierra Leone Health Agency, emergency preparedness, how ready is the country for potential hantavirus and measles outbreak? So, we get a good conversation for no more about the measles and the hantavirus after the break.
Like it, I go wait for you, make you decide. I no go force, I go beg for no when you decide.
Yo, what's up? This is incredible JJ Mr. Who does that. I'm live on Slick TV, channel 37. Tune into Slick TV, channel 37. Best for Salon, best for you, best for me, best for we all. Who does that?
Me have money, me honey bee. Make we go, LLE. Me I need for the close to somebody. Oh, me sweet cassava leaf. I cannot leave if I not get you.
Quick, don't put too much for me matter. When you go stop, when you go time.
What's up, people? Your guy there, so camouflage, the borderline seal, the Mr. Blessing, my body, Mr. Guess what? For current affairs and anything what I want for the entertain, I always watch Slick TV, channel 37. Get some nice.
As my name drop, you don't told them. You don't care. Hey, okay. Stasha baby.
It's Jewies on the beat.
Hey, where I'm from, Apadon. I get that money, hit the city, then I'm gone. Hey, we legit, we hella lit. Represent who you with. Hey, where I'm from, Apadon. I get that money, hit the city, then I'm gone. Hey, we legit, we hella lit.
With over 37 reasons, over 37 concepts, over 37 days, you have the opportunity to watch Slick TV, channel 37, every day for the latest in news, entertainment, and politics. It's Sasha Baby, and I'm telling you, this is the best in Sierra Leone.
Like my style, I hear they say I'm pretty. Drop it low, I am physically fit. So much love I put on for my city. Make them know me not born free on titty. I got the goons and I got the galleys with me. I love the vibe and I like the way it sweets me. King Tom Bobo, I like the way it treats me.
from wherever you're watching from. This is Farashito Kulala, your favorite music producer. And guess what? I'm on Slick TV. Whether you're there in Freetown, keep it glued to channel 37. They're also on Facebook Live. Tune in and get some nice.
Let me live around you like my habitat. In a mohi garden, the juke, and wanna leave my cloak, no more be moya kuda. Me recipe, me harmony, me honeybee, moya kuda. Me recipe, me harmony, me honeybee. Make we go, LLE, me I need for the close to somebody.
Nice.
All right, welcome back to Slick Television, Channel 37. This now the show, today's show after lunch, and with me, John M. Abdullah, your host. So, we discussion this afternoon inside the show. We will watch at Sierra Leone's health emergency preparedness. How ready is the country for potential antivirus and measles outbreak? Because of recent, we don't get two press notice from National Public Health Emergency or Agency. We don't get them notice that we don't come out concerning the measles preparedness, concerning the antivirus. We don't they happen, you know, all this don't happen at the country. But sometimes or years ago, as we began from the intro here, is that we don't get corona, we don't get Ebola. You know, Salon people, we don't pass through them. But yet see, we get other issues or God are sick the way that they come up. You know, of course, measles now, let we say, a household name, a common. But when it comes to antivirus, you self go to wonder, who's kind name this again, or who's kind sickness this again? But with that inside we conversation this afternoon, we get to guests that we go help with for discuss on the two notice, the two sickness we then say a day, the antivirus and that of the measles. We get Harold Thomas, we are the RICS Communication Lead Health Education Programs Manager, and we get Fuad Tijan Kamara, Final Year Medical Student, Commerce USL. Good afternoon, gentlemen.
Good afternoon. Thank you for having me.
All right. So first, the notice will come out from the public health, the National Public Health or Emergency, concerning the antivirus and this of the measles. Well, first, you know, these are two different sickness or two different things. We go for take them, see how best to they handle them sequentially or systematically, see step by step and all. Now, this antivirus we then say a day, Mr. Harold Thomas, and you happen to be the communication lead. And when you watch a time from the notice, not so like say it don't happen, but just one for celebrate for bring kind of awareness. Why you not feel like important for this particular point in time for pull a press notice as of when I don't pull and so?
Well, we always talk into this world, the world of this one now. They get so many diseases them we call emerging diseases that are new diseases that we can come. We get re-emerging diseases them. The one that we don't forget, but we they come back. And we get a lot of diseases, a lot of conditions, and happenings them of public health importance, and we they happen on a daily basis all over the world. So when we can done with one outbreak, for instance, Ebola, Corona, Mpox, we can always say, this one done, but not to when or if another outbreak will come or we go hear about them, but it's just like when. Because now with this one at this world, a lot of different things they happen. And most of the disease then, they then sickness and they, then we call them zoonotic diseases them. That means to say, not on mortal man no more it can affect. Some days then they affect animals as well. And it affects mortal man, But when it can enter the animal world, for instance, even when they talk of, Mpox, you know, we dey talk about other diseases like Ebola, chikungunya, Rift Valley fever, Congo Crimean fever, the other disease then dey. When they dey na the animal world, if the animal then get them, it can dey inside and the germs we can cause them. But it not dey cause any serious problem with them. They're not can sick, they're not can die because of that. If they sick or die, na other reasons. But when there is a spillover, where they come out from that animal world to mortal man to humans, then we get what we call animal to human transmission. And the moment that they occur, then we begin get what we call, you know, a sustained human to human transmission. For instance, if Ebola dey na non-human primates like monkey, baboon, chimpanzee, and all the one they they give them much problem. But if we interact with them, particular you know, animals there, too by we own intervention and what we do and the ecology, because we find out that most of the sickness and they sometimes outside the baboon them, monkey them for dinner, they will sit down now, we don't be loose. You know, long years ago, even the area, you go see in a bush and everything. So, you know, a lot of interference. So, when this can spill over, then there is a problem. So, we not for be surprised if we alert people and say, you know, we get this now this place, like the hantavirus, for instance, the Andes virus. We, you know, the saloon, you know, even the near saloon, you understand? And the threat, you know that as that high, we will say within the next moment, like how other disease and the spread, we could get them. But now with duty, you know, the National Public Health Agency, the Ministry of Health, and all the health development partners, them way they work for health, you know. Now with duty for that, we inform people and say, this they happen. You know, in today's world, we get what you call, well, the IHR, International Health Regulation. It always emphasizes a disease and they travel to, then they move to trade and travel, trade. For instance, you go there today or somebody go there, you go buy markets in Gambia, or you go Senegal, or you go China. The next moment you come, that's not trade. People then they move. They want them from China, they can here, Senegal, they can here, for instance. And also, travel. I can do in the morning. And it don't happen so many times I can travel. If I travel, let's say, if I go, for instance, let's say, let's call an African country, Kenya, for instance. I go there in the morning, I eat my breakfast. Sometimes by the time they say 2 hours from here, I take off. I will take lunch in Ghana. By the time they say like 6-8 hours, I will take me dinner in Nairobi in Kenya, or for instance. So if they find out, say, the disease and the travel at the speed of a jetliner. That means to say the plane, that speed where plane they travel, now the same speed disease and the travel. Meaning, if you the disease them, most of them, they not get vehicle for travel. Now we, the motor man, they are the vehicle. You go inside transport, you go inside plane, you move. Now we, they move up on. So you find out, say, these are the way sickness in the travel. So now you say one sick day, all the way, you know, the east or the west or whatever place. Though you say, well, no, well, thank God we didn't have a saloon within Africa. Like how they tell you, say, if they travel at the speed of a jetliner. So which means, in no time, we will get them. So that means to say we for be very, very vigilant. You talk about Ebola. When we get Ebola, at that time, you know, we health system not as sharp as it is now and everything. We rely on a lot of expertise from abroad, like for surveillance, you know, this epidemiology. Then they come other side, they come and other infectious disease experts and everything. But now, you know, the capacity we don't build in country is very, very, very much high that we even they assist other countries. So which means The Ministry of Health, for instance, what would they think of 10 years ago, they're quite different from what they now, or even 5 years ago, or even a year ago. Every day improvements happen. So we not the wait, letting happen, or something they under the carpet, don't it just come unawares and bug people. When we see them, we dey talk, we dey make people know. But unfortunately, you know, the day we dey prepare the antivirus, you know, public notice, you know, I be just a smile at the member say, this, I say, if you come out right now, people then will say, oh, yes, Mpox don't, they don't carry with other one. And as if to say like that, I go now and read television the other day, I think, I didn't call herself, Pike Seat.
Amaze.
Amaze. And at the same thing, when they do Vox Pop, all the thing I be the think of, 9 people then say they talk. When they play on the area, I just smile and say, oh, there one, all that thing, they want being come and this. We'll not forget that mindset. See. They make sure, see, we inform people them, you know, they will tell them, waiting for do. Like for we in risk communication, they communicate risks and event information. And we counter misconceptions, then, you know, myths and the other things. Because, for instance, if measles, they now don't, instead of you carry go hospital and say, rub this pan and get this for drink, that's not the problem. So we need for do waiting we for do. And like when they talk for measles, so, you know, we get diseases and we get thresholds where we look at some diseases and they like which time we don't call, so like if you get Ebola, you get Marburg virus disease, chikungunya, Rift Valley fever, Congo Crimean fever. Then one in the one case na an outbreak because that's not the threshold. This one diseases and we call them immediately reportable diseases. But like measles, one case no more not to outbreak. So you go find out say you see now we get like 41 and some area again 9. So which means when you get one case, this like we get the threshold so this like a alert, you know, warning so for step up and everything. You forget certain number of cases within a court in a geographical area. Like this area road this way, if you take an also take Ilcourt Road, go up Hill Station, go down Weekends Road, you know, within this until you get the 5 case, then it becomes an outbreak. Okay. So every disease gets immune. Some diseases and they will endemic like malaria. Now it always deal with twin saloon, endemic. It always deal with we. So we not get problem with we not go say an outbreak. In almost cases, if you go to any health facility where you go look the charts on the wall, where you see almost cases of malaria, but still it would become an outbreak. The other day I'm in Uganda, then get about 6 outbreaks together. They will get you know, this Rift Valley fever, then get this, then get that, then even get malaria outbreak. Some people then will say, how malaria for be outbreak now? If we get a center now, or an area where we get 200 people and we every month, then they report malaria, sometimes they go 120, 150, 210. If one day we can begin to see 800, and they go 700, you know, say an outbreak because it don't go above the threshold. You understand? Now, so we can even warn people them. You understand? So, not say now, if you want to say, we know they expect that because we get good interventions. Hey, well, we get an outbreak. Some countries indeed then get an outbreak of malaria. So, but this is not the issue. So, when they warn people, say there is an outbreak or this or that, now so for do, we they expect people then for adhere to the instruction because most of the instructions are very simple and clear. Okay. If you look at the public notice, the press release, you go see the advice you will give. It's very simple. If they say, what's you want? You have for do. Then say, make sure say you get rid of rodents, you know, rodents and like a rata, You know, the Arata and the big one, them, we go and say mice and then small one, because they're all different, but these are some of the things that are really responsible for spread of like the antivirus. Yes, so these are the things what they say do. Or for these measles, if they tell you, say, can you pick go for Maclate? Maclate not free. Then they even go host to host when they go and say, but they don't pass Mac every day, then they can't give you Maclate. Then we don't give you for polio, then can't give you for this. But the reason and some of them things also.
Okay.
You know, it's very easy because you don't get for pay for them. But if you, and like for measles, for instance, but we will come to that. So these are simple instructions, but when people in the area, they always, these are now the people in that they really say, okay, we know they do this, but when they, oh, they don't begin this, not so we they begin them. And we say knocking like that because a lot of, you know, inconveniences and a lot of, like, you can imagine, you know, yes, I think yesterday or this morning, you know, I get I get this information for Kenya. If I've not been there, I thought they do some other thing, you understand. Sometimes and even this morning for even communal news because I do some online, so interview them. Even sometimes by the time you want, you know, one gets up, you get called, you get, you know, it's difficult even for each or everything. So these are not times where we can happy about some of it. But people, you know, then they feel say, and for make sure say diseases them, you know, we stop them or we control them. Now two way, we have the experts. Okay. Like when they say doctor, you get your nurse, you have people them, and then we have the community people them. So we need to have a fine balance between the expert knowledge and the lay perspective. We in the community. So if all two not match together, then we will get problem.
All right, so we'll be coming to that later. We'll come to that one day for sell best, for getting solutions as of what the community or the people fit for do. Now, in your explanation, saying that you know the sickness not kite, it is far away from us from Salone, and you get a rightly clear from you say, you know, this is not something where like it transfer through mice or rats. When you get there, far them. But people out there, we go to watch you, go to talk, say, if this man, they say, and then sickness and a rat or then small mice, they cause them, we have been living with these things. We don't deal with them for a very long time, you know, as, let we say, everyday life. Nobody knows this until we this alone, we get place, or you enter inside rooms and say, no get rats, or for the day, rats not go inside your house. You know, why this time? Is it that always when sickness they come, now only through animal?
Well, I'll tell you, when I begin into say, they get diseases and what they call zoonotic diseases. These zoonotic diseases are diseases that will affect mortal man and they affect animals. But when they then are the mortal man, the animal young kingdom, and now they do them nothing, then they live with them. You understand? You know, they affect them most of the time. But when there is a spillover from the animal to human, then we get animal to human transmission, and then we get what we call a sustained. They're not saying human to human transmission, sustained, because that means to say it is there for some time. It's very difficult for you know, get rid of. So these are the nature of how disease and the but. If I come to the point, let we know, okay, begin the thing, say, okay, yeah, we get rats there, we get then small one and everything. You know, disease, we get what we call the disease triangle. We get different factors with the cause. You can get the aratana, but if you're not infected, even malaria, the thing with the jam to the cousin, if the mosquito no get them, like you bet you know.
So how you feel say this go for this go for affect, like we say like we own animals them or the rata that we talk about where like it's in the far force out of Salone, you know, reach Salone yet.
And this what they talk to right now. When they talk in that sense we now animal right now it don't already establish. I don't say it don't move from animal to human. Now human to human transmission. So which means if person get this, other person who interacts with them, however far, he move calm. You understand? If the person they get the disease, they get period where it can deal with, you get you know the sick, you know they know it. Say before you begin get the first sign, Sign na wetin person can see by you say you get sick, or the doctor, physician. And symptoms are wetin you dey feel. You understand? So if there is then get a period from the time you can get that, you can contact the disease. So they tell you the shoulder first sign or symptom. So during lengthen and day, you know, you can move with a disease and all of these things. But now with duty, we're not going to say because people and they react this way, say, oh, other one don't come back, they don't bring other one. We are not bringing diseases. But we're not going to feel, say, because of that, we go afraid for even toxic diseases and day. Because if you know, for instance, if you walk inside this studio, one deep hole the way, if you follow, you go down, you know, go come up again. If then tell you, say, hey, all day now, you go not say, either I go pass through or I go pass through, it better. But I'm not telling you just go inside it. So now that's not the principle we make. We always inform people and say, there is this and this and this. Remember when Ebola, COVID, Salona one of the last country we've been getting. Because now a pandemic way, eventually everybody been forgetting. But we delay the first case. You know the importance of this is because when sickness can happen, sometimes they not can get too much knowledge about this on how it for happen and everything. So if you allow, if any sickness ever get for come, if you allow that, it just come once, it go more than you pass where you can later, because that time they go don't they get solution now for doing, we don't get experience from the other people them and every other countries them and everything. So this now the thing. And one thing, any disease, why we can be very, very alert for cotton, you know, when we say nip them on the board, because it's important. They say prevention is better than cure. It's far cheap for prevent than for treat. We person sick. So what thing we do, we can always try for make sure say we not, because when if any outbreak can happen, for instance, in any country, if you not do nothing, at all, it is spread. A lot of people then go sick, then go die, but not everybody will die. After some time, like they not treat nobody, but it would say a lot of people go sick, then go die before it go just go down like a dandy. Okay. But it will take years, and you know what thing would happen. But when if you be as it come, if you start for do much intervention, then you find out say it cut and quick. Instead of people rise up, it begin go down or it steady down, it go.
Okay.
So the earlier you put effort for let it go, the better it is.
All right.
But the problem where we get because of perceptions, people then can always get certain things. You know, say even measles, for me are small. You know, people they talk say we picking and get then say na which man again. You don't hear that. When they go say one which man there, it been get 5 bag measles, it open 2. And I made them picking there, you get for open other bag back.
Okay.
But these are not the case.
All right.
This the disease that will be caused by I can say germs, because some people then can say tumbu, but tumbu different to immune knowledge, you know, na tumbu na they can mag up. But from one small, how we can explain germs? Germs are English and science, but it better we say germs. Some small things that we know they see, even we can cause diseases. Okay. Most of them diseases and something they cause them. We get causative agents really cause them, but not to which man. Or let somebody picking not go sick again, measles. They begin, they see one old man in the neighborhood, they begin the cause, or they talk, say, hey, the one which me picking, this is not the case. If that happen, then it goes spread.
All right.
We get waiting for them.
Okay. So, okay, la hold you there first, Mr. Harold Thomas. Let's come again to Fuad. So, Fuad, from a medical perspective, what do you feel say, na this antivirus, and why you feel say you considered animals the much for carry this particular virus?
Thank you, John. Good one. I think Mr. Thomas already explained most of the things. It's a zoonotic disease. And when they say zoonotic, they live with the rodent animals then. and within the animal for them, it's okay. The animal live in life and all. But when man they contact them through the animal, maybe the animal in peace, or with the animal in toilet, or maybe if you put food on cupboard, the animal go eat the food. Of course, we know some people they make proper hygiene of the houses. Then they eat that food. The animal in saliva, they hopefully get the disease. And as Mr. Matomo say, one of the key ways say of course the preparedness. I think one of the key things for say this country are really prepared for ready for any emergency outcome. One thing are for make public awareness and we the National Public Health in collaboration with Ministry of Health, we they don't do. For no say okay this sickness I do, despite come it na salon. As we be all know way for Ebola, we Ebola be come be there first when neighbor come to say Ebola. Maybe people not be too taken serious. But like when it come, you see the destroy lives. I think from COVID-19 now. Even though it can salon, but because of that awareness done, they say COVID down in social countries, make later we come, make that better impact at the country. So it's similar thing back where this hantavirus back, where the say in America also, say it don't come. So if they still not talk nothing until it come at the country, so it go difficult if people even gain knowledge about the antivirus. So if you don't gain prior knowledge on that, now they have to make preventive measures, as they rightly say. We get two types. We get two types. For that one day, purely already in South America, what they call the new antivirus disease, where they affect purely the Americans then. But now
purely the Americans mean show difference. Would I for attack?
North and south. We get two types. We get that affect the African, the Asian, and the Europe. Where the old antivirus, called the new world, the old world. Of course, the African. We get the new one. Of course, this now we come probably because it's not the antivirus. And the antivirus, now like thing where one of the strains from the disease that they cause antivirus, whether these rodents they are. And this now, in a transfer waiting, where me don't get some. I will transfer to me company as compared to where other causes then they cause antivirus. And the fatal rate for like person get them is survive. It now like if for instance if 10 people or 9 people in contact them, end of the day, 3 people and 4 of us lost their life. As you can see from the cruise ship. Then say 9 people in contact the virus. End of the day, 3 end up for they lost their life because of the severity of the virus. So in that light, I think that the other reason make WHO try to say it's a global concern. As Mr. Thomas is even they travel right now. Maybe you can travel, you go on. But the difference, the only thing for the antivirus here is they spread like the COVID-19. I they spread maybe 2 airborne disease as well. In a only way getting close
relationship,
contact, intimacy with you company man. Although they travel here, but like we get close intimacy, just like we talk about the mpox. That's why the mpox they travel, but the key thing now we get close in connection with the person we don't get the virus. So I make where this come, they say, okay, this type of virus that they transfer person to person, it is a global awareness. People have aware say if this sickness don't come this cruise ship here, let aware say get for spread because of as people they travel now country to country. So like the awareness now where of course you see the National Public Health Agency pool, because this is all about hygiene. It's all about antivirus, it's all about hygiene. For example, also of course we get squirrel, we get them grumpy, we get the rats at them, we get other animals they live with. But so when people if you get proper hygiene at host, then say they can get for they around, even proper sanitation. I think that some of the advices they say the preventive measures the way NPA with Ministry of Health they try for make people aware say even though this disease not come in salon, you have to go for beginning time for prevent them, let reach here.
Somebody from that village, that mommy where you don't know waiting a city safe. So that mommy where waiting at that village, you don't know waiting a hygiene. You go to talk in your mind say, I don't live in this village. This hygiene they talk about, me don't know about them. I don't live with the animal here. Where you turn so it, they pass so, where you go so you see them so. Why now they will count about say that the animal here they give antivirus?
Well, as they rightly say, probably the rodents, maybe the animal will get the virus. Because like, just like as Dr. rightly say, even the mosquito they bite you for like malaria, you get some mosquito they not get the mosquito, the parasites where they cause the malaria virus parasites. So in that light, even if the animal will get time, but then people are now already apply now, the easily way we will contact them. Like this, like what I say now for spread waiting. The notice say, okay, then thing I want to eat. Maybe someone will say, my granny or grandfather eat some for how many years? Say die, you know get this sick here. What about now that they can't talk say This sickness now they for animal. So one can even just like as they say the meat, someone will say, well, they continue for the eat. And I think that's the importance of the police awareness. Everybody knows now. Even though they expect to eat things in the, you have to be very careful. But now this is all about eating. It's about with hygiene. Like as I say, you have to take care of your home for cleaning your household well. Make sure say it protects your food. And I think that the thing the way that they try to make people aware. But as they say, the country go for research, we are still developing country.
So what are the symptoms that way if you say people not fit for the ignore?
Where you get the thing
For like, for this particular virus.
Well, one of the symptoms where this virus, as they say now, that's one of hygiene. Like you can get fever. Now one of the things where come on, but as they say, people are not used for fever related.
And people don't get fever before
with lots of other things them. But I could encourage people and say, if you get sick, therefore they make self medication because somebody is very sick. For instance, if you really have food, say sick, you say I go buy first Panadol or I go buy headache because of a sick. So I could advise you say as an individual or someone who is sick. If you take, maybe buy Panadol, you take and feel okay, observe yourself first. If you feel like it's still the worst, you advise you come to hospital and we do necessary test them by you because a lot of people tell us no more say you get antivirus until we can hospital, we run by you the labs. But the difficulty, if you come early, I feel like saying we're able to cure you. But if you come late, people are not going to, the thing will not burst. So it's difficult for let them even cure you. So now based on what you can hospital, and able to assess you, say, okay, likely this person I get this sick here, I get this sick here. Or probably, where you can say, okay, me I didn't have say I got them boku. I don't say problem go be think say, okay, likely this person I don't get antivirus. Or me, I didn't area where I see boku push of school toilet or peas, or even maybe not get proper as I say hygiene. Then we begin to think about say, okay, this person I get fever. But because of eye exposed, or maybe for instance, I will tell you say I want come on another cruise ship and discover say then get the antivirus. Then we begin suspicious say, okay, this person don't carry out with fever. Then don't pour all the way to explain based on what you don't come. We will likely say that this sick I get, but we need for do 2 confirmatory tests where we go do the labs, then do probably blood tests, then we know say okay, you get this sick. But now we just can't no say you get this sick. So I make the NPA with the Ministry of Health, they send awareness to people and say this sickness here day. So if you didn't have endemic area and they outside Arata then day or this then day, this then day, if you didn't get fever or whatsoever, try at most means Canada hospital setting, then try for know if you really you don't get the disease because like we know why the disease has spread, like how other diseases spread. Of course the disadvantage here, there is for now there is no cure for the disease. So if the disease can spread, now it will be a worst. And this disease are way as I say a fatal disease where you see WHO try for pull press release for let people aware. And I think that is similar thing down the back where the Ministry of Health and National Public Health Agency try for do send awareness to people and say despite this sickness not can assassinate, this sickness allow for put a stop to allow for prevent them. I think from the press release then do one of the key things. The second thing back for social and prepared now surveillance. Of course from the press release they tell you now the airport, the seaport, the healthcare facility. I think they try to get a surveillance system we go do the like propose really come.
So that's not just from the press release. You don't see them?
Well, I'm not going to then.
So how you go determine say that's not one of the good things that's what they don't do?
Well, for now, if since they don't have press statements and Mr. Thomas there, we probably going to give more insight to that. But for let them talk say already they don't put surveillance team. Now one side for sure say they don't prepare in case if the sickness one can able to contact them people and we get and two of them the borders, the seaport as I say, the airports, based on them. Press release, so they say despite the signal commits at the country, and for sure now one part of the things for sure say now we really prepare for fight against any emergency sickness we want for come in at the country.
All right. So, Mr. Thomas, something we get from the particular notice now make mention of say the notice say the risk to Sierra Leone remain low, but watching at this, waiting at a specific mention at least say through the ministry apart from this particular notice we do where we don't do. For say the country remains safe from the antivirus.
Okay, this not for antivirus no more. For all diseases, we get a list of diseases and we call immediately reportable diseases.
And I get list of them.
Yes.
So somebody could say since when I get list, just
and that list they will get then different diseases and they not to. For Salonoma, we get the integrated disease surveillance and response, where we get the number of diseases who they monitor on a daily basis. Some of them are immediately reportable disease. If you see them right now, you know the waste them. Some are weekly, some are monthly, depending on the type of disease and the importance. So we they monitor so many of them diseases and the, you know, the technical people them, where I mean the health people them, we every week we they share what we call the epidemiological, you know, reports where they show we how we they monitor them disease and now we not they do passive surveillance. When they say passive surveillance, they sit down and they can't say, hey, we see one case where he get fever and the person they run belly, this. No. We they do active case search. That are active surveillance. What they do. So we not they sit down. We get people all around, even at community level. So the community health workers, them people that when lay people them with them train for their own level. And most of them diseases they see. If we get a lot, the way we put, like if you see 1 or 2 persons around this area, then they get the same kind of symptoms. And they say, hey, me idiot. Then they say, me idiot. So then they say, hey, I get back pain. Then they say, I get back pain. Straight away, then they alert. So we investigate. We get that system there every side of the country. So every day we get reporting system. And Salone are one of the countries where we call it the EIDSR, Electronic Integrated Disease Surveillance and Response. Other countries in the land for we. Some people some countries are paper-based, but we get by electronic means. So if you there one village safe, safe you not get internet there. When you don't see some of them things, the way you put them, you don't send the report, it is on the phone. As you come to cyber coverage straight away, you don't register Usai for go, and we monitor them on a real, I know we say daily, on a real-time basis. Real-time means if it happen right now, you always hear me phone and me watch where the alarm and waiting and call. We get that kind of system in there. So if something happens on site, people in the way they look. If you go now, outside them they call it EOC, go see, let you see the system we will get there. We get like people away. We get watch officers them. We get screens them and everything. Where they monitor every minute, every hour. So these are the things that they do. Even for how we they communicate, we risk them like what they do so. We they do them in a way now, not so that force them. Right now they talk to some of my colleagues them, I think 2 of them right now, then they Ghana, where then they work with system who they use in a year for risk communication. That system they try for Ghana one time, they try for go build in Ghana. Gambia self that the next side, Guinea. So the West African Health Organization, why we don't say this with system, then they use them across, the different countries, and so that we're able for, a very sharp. So some of them things, like when they say, talk about airports. You go to airport, I don't know when last you go, even when we get Mpox, even till now. Look at them screens, they're all at the airport. Mpox messages and then they roll out the every minute and hour. So these are the systems we use. We not like force them. So we not believe in not all time for the go paste poster or go begin to talk to people. And we get certain things where we do. So the things and this way we do. Because if we not do that, we not go wait till the disease like where if you drive now you get motorcar. The one bad bridge, don't then go put signboard just before the bridge, look here, say dangerous bridge. Most people then will go say, as you say, you don't go inside. But then for put them far away, where they say dangerous bridge ahead. So where they can say that's you get for slow down. So now that's what they do. Something like for happen far away they talk, but people then if you say not to everything where we deal with that and say, oh, this is money they want. Then because they don't put money per Ebola, they're not waiting and calling, and that's made them waiting. We aim now for we get a disease-free salon, but it's not possible. The world now as it is, even like we'll talk about measles in the U.S., United States, we highly sophisticated, even pass way. Then they get, measles outbreak. You remember, they get hundreds of cases in America because we can do certain things, and even when you do them, some people then call it anti-vac. Some man and they say, oh, me picking will take vaccination.
Okay.
You know, will take vaccine. If you picking up, if you say power you picking up for take vaccine, waiting on the mean. If any sick come, he go get them.
Okay.
And if he get them back, he go likely spread them to other people. Them. So these are some of the things what we try for make sure say we put in place for make people because now first the Ministry of Health been so overwhelmed. Anything that Ministry of Health. If like there is an outbreak now, all the stuff they wait for they go treat person like Beleoman or possibly just get malaria or for do operation, they all go goody for go fit. That sickly. But now they don't defy them.
Okay. Then
get the National Public Health Agency really for the emergency then they under the watch of the Ministry of Health. Then get Ministry of Health. So it will tell like say if an outbreak they even like a really other outbreak then they now Ministry of Health they do their work still. Don't National Public Health they said they do their work still. So every day there is improvement in health system, in the country. Because we don't want to make, things beginning happen, we wait as it don't happen. It's difficult. Wait something don't start. For let you stop them, than wait it not start it.
Okay. So coming again to this press notice, to the notice, this now another note concerning say, over 41 confirmed measles cases were recorded between January to April. Now, comparing how you feel say this particular one is serious than the previous one?
Which previous one is it?
Anyone that don't happen before?
Yes, of course. Yes. This over time. I they tell you say measles, not of the kind of disease when like we get different categories. One case is not an outbreak. 2 cases, no. 3, no. When you get up to 5, then an outbreak. So if you compare, you understand this with other diseases with 1 case, the threshold and 1, a different, you understand. So, but we they make sure say we monitor these things and we pick them up, because when we do prevention for measles, 1, primarily measles now what we call vaccine preventable disease. For instance, if I'm small and 9 months, baby, then give me measles maculitis. If I don't get immunity, that's to German in my body, except for 60, 70, 80, 90 years, I no go get them again. I'm not likely forget them again. You understand? Or if I be don't sick up, I no go get them again. You understand? But if you not take the maculitis, then you stand the chance for get them. And when you get them, what thing will happen? Not for let you get you well nine at the thing. Any disease, some people and the immune system, the way their body they felt sick because of other sickness, they not that good. So any kind of sick, now if I let you not get sick, then you get them because people like sick where you go say, then can say like you sick when not for kill you, now go kill you. This person will get them well. Sometimes they take medicine safe. You don't see that. Some man is sick, they go hospital safe in the way. But if you mistake one other person gets them, you not go hospital, now you go make you sick or you get disability. Measles, if Peking gets them, they not treat them well. It affect the eyes. A lot of Peking will be not blind before. Now they not big man, titty, and don't old, then they as blind eye people them. Now measles, now cause them. You see how it not kill them. Some people then with then deaf, where they know the hearing again. Now because of measles, you understand? And other one and even when you get her, the rash, how they come out like your body, the internal organs they affect.
Look like this.
So if you get them, sometimes even the muscles them, now you heart, the valves them, it can make it narrow. The blood they go through. But you get measles where you 9 months or 1 year or 2 years, you don't get handy. Don't you vessels and the pipe inside the blood and the come out. It don't narrow. That thing they know they do. Sometimes we 50. Sometimes that thing they as they give you promotion at your office. That thing they don't narrow now. You have to know the able to perform better. Collapse, you die. What thing them go say? Hey, that man they as they get promotion, he don't die. Nothing not been done. You understand? Sometimes when it's small, you don't get measles. Now you don't make it, you don't reach it. He not die you. But some them they even when they die. So you don't see how measles is serious. But the magic bullet right now vaccination. When you give vaccine, and now when you give the vaccine, it's not like any other thing. Sometimes if you carry your botuka go in a garage, let's say this a amog. Sometimes they go fix them, and not the work. No, so but then go try back. So measles self, like when then you give like 100 picking this measles macrate, not to all at that time the vaccine can work good one. So for some reason, sometimes that picking it might not reach too much. Or you get others sick like this HIV with it and others sick them. Sometimes it is not the work, it not work better. But that it not do so. But you see, we make it so easy for people. When you go 9 months and give the first dose, first and they call them booster, we call them a second opportunity. At 15 months, that is 1 year 3 months, you they go back and they go give you second dose. So if that first one they not work, good one in your system, the second one they work. You don't see? So 9 months, 1 year 3 months, 1 year 3 months, you don't take them 2 doses then they, with that space there. There is nothing that would make way measles and they can say, it go jump you, pass you. It go to other person. And in fact, when you get them, it become a barrier. So it just like now I make with the talk but hard immunity. If like I say when I make fence now, right now, when I hold on yourself. If bad person one kind inside, you're not able because of way when I hold on yourself. Then that kind of thing. So if some of the people with the around then don't take the vaccine, it they even help the one themselves. We're not fortunate for one reason or the other, not take them. So vaccination always very important. Okay. But again, people then will say, because they take my plate, where the picking ones, that polio. As it born so polio 0. Now you get for take polio 1, 2, 3, a lot of other in my plate. What do you mean that they do all that? Now for save that picking day from then sickness. But so my mommy go say or somebody go say, but this picker, I don't say when they get this macrate too. So he do so now. He go say, well, me, I born 6 picking them. They not being get macrate, they not die. Okay. They are lucky.
All right. So Mr. Thomas, that holiday and that coming into you forward. You don't see some of the signs, symptoms where Mr. Thomas don't highlight when it comes to the measles. Now, when it comes to community awareness, how you feel like important for get that kind of community awareness for see our best for prevent an outbreak?
Yeah, just like we say, we talk about the hantavirus. In that day, hygiene. And when it comes to the measles, as Mr. Thomas rightly says, it's all about immunization. And I can remember some days back, we just come up from rural postings, from all the way Kenima. Good, like we do some outreach, tell people about this immunization stuffs. The part where you go notice, where they find out during the outreach, they find out say most people not can go in for the immunization. As Mr. Thomas rightly said, this now waiting a preventive something. So like if people already go out for go take the immunization, end of the day, when you don't pass below 5 years, the tendency of for let people and die is so high. Because like this outbreak now, like we say something from 1963, where they discovered the immunization. Because like they found what they call this immunization vaccination. Picking every 5 years, they die under 5, they die massive one. So they say, okay, it's a lot of get a program for prevention and so they call it immune vaccination. So like waiting is there shows Salon gets 41 cases. What's made for the NPH and Ministry of Health for patient awareness for so say the community people the need for aware of say immunization is key. Because when you immunize you, like we also those more before the 5 years, you give you both those 9 months and 15 months. If for like big and get the sick, it's difficult. But like the sick now, we picking get them. quick for like loss in life. So I think make you see where they send awareness, say, okay, we don't get an outbreak. Because if we all are sick, we don't say, well, and the picking enough for survive. And we try to prevent waiting on massive mortality for under 5 picking them. So if we don't get outbreak for 41, as usual, now mark at the time for tell we say, the vaccination sensitization, we need to do more as a country for prepare people and say, don't go out, don't go tell people and say, this is a must. Not so for say, now you do other. And the measles, you know, like where they spread wildfire. Just for example, where they burn grass, you put fire param, I saw it spread. So I mean the measles they spread rapidly because like now airborne something. If like all the talk so like for example, if I get a cough, maybe they spread in this environment. Everybody they get some. And after you know go into for say immediately it gets the sick, now go show by you. Maybe now after 14 days, after 10 days, you go detect say, okay, I don't contact this sick here. Okay. And of course, I think one of the things where the MP they say they try for do it in ring vaccination now for try for prevent the spread of this fear because I find out say this is already done in at the community them. Because of the thing now free to especially because if say April of April we got about 9 people within Freetown. Now not the key reason are waiting overcrowding. And when they within the health sector, you can see sometimes now the PCMH where people they go take the vaccination, the vaccine also. You can see like the people are too much. And maybe now one day small side gets for go do the immunization. So man, because of the overcrowding, because you know the people and say, okay, anyway, let's go first. Let's go do other thing. Because most people are now they don't get aware. Say, okay, if I'm gonna be CHC, then they go give me this immunization here. I feel like say one of the things back where as a country we for time for prepare people and say it now. Not beginning time for go back host to host as well. Even though it did, as I say we do outreach for we go Kenima recently for tell people about this this immunization, the EPI training. Say for go take this there because sometimes I remember I did on our CHC. One patient come to we, which in picking up well, try for go. Picking get fever, so they say now one of the commonest signs. Picking get fever, and not watch throughout in immunization card. Now only the first dose, the BCG don't get no more. When just born and the OR where they call.
So many the parents don't go time before.
Patients somebody go for go take the follow-up immunizations then. So like I think one of the challenges the back way we need for as a country we need for step up back. Say like, let me reach out to people. Let me tell them say this is not do or die because people feel like say okay me. Like when as something they say, someone go they just stop on no more hesitance. That vaccine, of course, remember I tell you Ebola because initially when they tell for give people medication for them well. So when the thing spread might say, that medication will go take and make you die safe. So make people they fear. And upline said to most people that herbal medication. Of course, they see and say a rash. One of the symptoms for measles and waiting a rash. And most people when they get a rash, they use that continue. And the more you use that continue, the more they waiting. It is spread.
But people don't use this continue before. No? As somehow the other would watch. Now this we don't meet before this time. We don't know what's in a hospital business or with man business. You know we don't they sick or they know they sick. The mama they not this and that. They don't they pull for them. Now society water they don't they wash the with. But yet still, you know they know they do fine. Talking about now hospital.
Okay. Well, that way they say so. Like before, because even the medicine they make herbs. Right, but just that no more. You never put into waiting the right waiting concentration or dose. Where you go take, where not go away. Sometimes you can make some picking there where they go up because one up now come out, right? But some people where they go up because of they overdose them doing the apps then they maybe in the long run it go tell on you.
And they misuse.
You misuse because maybe they go for example read some herb medication go pack and buy you. Maybe for the moment maybe go much better. But as they go in the long run, therefore, make the mortality rate be so high. But when they call this EPI training, this immunization training, they find out the mortality rate is low. So for now, if we don't get an outbreak of measles, waiting they send signal to people out there, may know say we get to begin we just born down under 5. Let me go to hospital for go take we immunization maculates, especially the measles after you begin on 9 months. Because some parents and people normally can go after that. 3-4 months at the hospitals. The moment they begin 5 months, maybe they begin sit down, feel like say they begin try to work around 9 months and above now. For them, go to the hospital for go take the immunization card. Pass when they begin sick. And when you can go to sick now, work in the hospital setting. Now that's going to say, count immunization card. You begin telling someone only the first 3 months you don't take immunization. The remaining, you know, they take them. And as they say, measles until they spread like a wildfire. If you get them, it is spread. And the highest one of the killer of under 5 picking them. And I want to be getting like a measles. So when I make I feel like say when this still come, send an outbreak to the Ministry of Health and National Public Health Agency, say, for make an awareness to people and say, this don't, they don't for tell you, say, people already go out there for take them market, immunization market. So like, even with the doctors, them, with the actors, the medical practitioner or whatsoever, for begin educate people back where they born, say, do ya, when you born in Piki, after so time, will they come for this market? At the end of the day, they're going to help for reduce the body. But like for instance, if you don't get the vaccination before, I'm not going to say you go to it, but difficult for you to get time. And all that keeps him back, people can go for only for the first dose. As the first 9 months, and go take the first dose. After the 15 months, whenever go take the follow-up dose for complete the dose, then they go again. Now after, so and then people in the back, once they get tendency back for waiting, forget the disease. And later also for spread them na the community as well. Like one of the kids now will get overcrowding in Freetown. We get people who hesitate for go take the immunization. Despite to the people they go awareness day, say go for this. And I remember I get one talk show about vaccine immunization. For tell people about the importance for go take this vaccine. Why make it important? Some people like some more this and just doctor some more just go take no more. I think they say this thing back go for begin go out back again. For educate people them say it's very important say we don't born a picking. Then we don't know 5 years for follow the procedure. We doctor they tell you say go in for go take you immunization.
Okay, so lastly before we go, Mr. Thomas, you know, why outbreaks still happen despite people they take free vaccine or despite free vaccine day, but outbreaks still happen?
Now, one of the reasons waiting you they talk because you don't talk and they have please treat them while you say well. Some people they're not being they take maclate, but they end up then nothing not do them you know. But we that kind presentation then they cause problem, the mindset, the perceptions of people. Like I tell you, for most small, long ago, people are not be take maclate, but now who that you know they able for survive and they survive. Because when picking small way die safe, they never even contact say and say well, this year. Sometimes my amigo tell you say na 4 picking I get, but in actual fact, you don't born 8, sometimes 4 don't die. You say this year I go take them, or then kind of thing they or you go say which man or na wait then get all kind way where they can put them. And you find out say first thing, like how they see people and where they get right now, they get polio, that die foot sick. And the polio when you get them. From if you don't get them for 2 years, say if you 80, 90 years, if you always get them, the polio jams it come on your body, but you still would go with the disability you get. And even blindness, I remember they say we women small, I did na school, na class, primary school. I be they sit down with one colleague in a class, we been small so. One day, 2 days, not they go. Say like 1 week, and then say no well, what's happened? He gave measles. And after some time, 2-3 weeks, he come back. You know the problem where you can't get now? Listen, yes, he begin to pull pause. And yes, them. Pause the commodity. Say the one day where they be this, don't and then the gap they go to the other side. Because you know been get good, you know everything. So after that 10 days, we all long scatter long ago. One time we meet up. I did talk to the man. He said, a big man like myself. You know, the one that say, you know, sabi me get the talk. And then somebody they make sign to me say the man no dey again. So but straight away I remember that time in Ghana Mizu where pause be the common and stay don't big now. It don't make the man on deaf. So other people they don't blind. Not also them born or not to witch man or not to bad people. Now just because of measles they cause all them and they you understand a lot of other sickness like polio and everything. So let people not say I don't born almost speaking. You might be lucky at that time, but not to everybody will be lucky. Like how they say, we 10 kinder, we sick. We know some then go hospital, some not go. Some then they well for themselves. You understand? But not to everybody will be lucky. Some man not they sick that sickly. You remember where polio come. And when you get other underlying disease, like even the measles, if you can now they eat better, when they say the yam where they eat now get better than body, it small sick like measles, it make it die. Okay. Or you get problem. Or even if you get other sickness, where it go there. Because you find out even from Ebola time, but who will die? they may get underlying problems here. Even COVID, you understand? Underlying problem them dey. Even mpox, other things they then sick then they wait there, other sick come. Now they able for make sure say they finish you. Now so it's done. So now that make no you know when then prevention and the but if now for any reason any pikin get measles, you don't get her now. Okay. The vaccine no go mean again like how my colleague talk now Fuad talk. You know, it not go mean you understand the vaccine na prevention, not to treatment. You understand? So with the gear for let the person not get the sick. But when you get for go early enough for let them go take measures them for save your life and make it not turn, you know, where they can talk and create not turn other thing. Okay. So it's very much important that this what they do. And I want the public then take this anything what would they tell them. Let them take in good faith say will they do them for let the disease and not spread or let problem not in the country. But if the one day where they talk then they I can always say when people then they die, we outbreaking can the cases and they go up, but could they sick and die now because of them. Because if me they or you like where you do so, they respect you in the community, even you host. But even if you also they respect you, then say you land book, you waiting and call, then they talk to you, then sick then in a lie. You go expect that small picking. Okay. Where not reach you for make it go against that. Instead of the same thing, it will talk. So and now that make more and more people can fall into that trap then get this problem. So we for listen to advice where the well-bodied people in the giving.
All right, thank you very much, Harold Thomas. We are the Risk Communication Lead Health Education Programs Manager, and we get Fuad Tijan Kamara. We are the final year medical student commerce. Gentlemen, I want to say thank you very much for we get a good conversation and above all the awareness we don't create concerning the antivirus and that of the missile. So with this, we say. Please take it to yourself out there where you take your time for watch the show. One for say, stay out of trouble. Continue for watch Slick TV as you go always continue for the Get 'em Nice. With this, we come to the end of the show and be with us again tomorrow. Today's show breakfast and today's show after lunch. With me, John Abdullah, say bye-bye. Thank you to the production team.